My name is Rebecca Rhee. I am the Program Director of the General Surgery Residency. Any prospective applicant that comes into our surgical family should expect to have graduated responsibility as they progress throughout their years. And by the end of the program, they should be able to operate independently. A lot of our residents, most of them actually go on to advanced fellowships. And then we've also had several go into general surgery practice, and we feel very confident that they're able to operate independently.
I think that there's no greater privilege than practicing the art and the science of surgery. To earn the trust of another human being who allows you to operate on them is unique in human history. And that means that the training that a young doctor has to go through to become a surgeon is totally unique.
It's a 5-year program. It's mainly a clinical program, but we do some academics as part of it. Almost every faculty member is involved in some form of research and is doing something to advance their own fields, and residents are welcome and frequently involved in some of that research.
I think it's important when you're in your career to be able to leave work and still feel inspired every day. And with the abundance of talent here with all of our surgeons and your colleagues, it's easy to have that feeling every day.
We are by far the most sophisticated tertiary care center in all of Brooklyn. And again, Brooklyn is a city of 3 million people, and that's just a staggering responsibility. And so there's a deep immersion across all nationalities, all religious groups, all races. Our patient bill of rights is in 43 languages. That greatly enriches the fabric of training.
Most days feel, again, challenging but manageable, but definitely I'm always feeling pushed, and case diversity is amazing. I'd say the spectrum is just huge. You know, you could be involved in a robotic hemicolectomy, something very invasive, very technical, and then the same day you could be doing a excision of a sebaceous cyst or something that's a centimeter big.
We have an emergency room that saw 130,000 patient visits last year. Our OB group delivered over 9,000 babies last year. In the operating room, we did 22,000 operative procedures last year. So we are busy, busy, busy. We are a vital part of the fabric of Brooklyn.
Our day-to-day cases are what others may consider unique, but could be just a regular day and a regular patient at Maimonides. Oftentimes I go to these national conferences and there may be presentations about what other surgeons may consider unique, but when I see these cases, I think to myself, oh, this is just a normal case in Maimonides.
It is very busy. A lot come through the ER with surgical emergencies. A lot are referred to us on an elective basis. So we see a lot of patients with unique problems. For example, we have a large Chinese immigrant population near here. And so we see a large proportion of gastric cancer compared to other places. So we do help a lot of patients.
At least 1 or 2 people in every specialty that you can imagine. You name it, we have somebody who has had extra training in that field. So in terms of exposure for the residents is unbelievable.
The diversity of cases is a big draw to coming here. Our attendings here are pretty renowned. We have giants in all of our fields, so why wouldn't you want to be mentored by the best of the best?
Everyone is just one big family. We're always here. You have such a great support system, not only with your co-residents, but also with your attendings. And then just being in New York, it's such a central place to be. There's so much to be seen here. It's a great place to live and as a young professional to pursue your dreams.
I grew up in Brooklyn. My mom worked here as a nurse for more than 20 years. I always knew I wanted to come back to Maimonides and serve the community that I grew up in.
We offer a world-class education with the most advanced technology, but also we have a tight-knit family community feel, and I think that's what makes us really special.
For a bright, young, motivated medical student out there who wants to train in a supportive, collegial, warm, embracing environment that will challenge you beyond anything you've ever been challenged before, we're the place for you.